Doctors of Reddit, what was the most incorrect self-diagnosis you've encountered in your practice? Anal cysts. Nope. He just touched his anal cavity too much and left it irritated. He was just checking for anal cysts every day. Patient had diarrhea. It was yellow and liquid. The patient said there was something very wrong, and somehow the tubes got crossed inside of their body because the pee was coming out of their butt. Patient calls 911 because they are in cardiac arrest, not a family member reporting that their heart had stopped. No, the patient made the call and said they were in cardiac arrest. Patient comes in with a gangrenous toe. He says it will get better with antibiotics. He doesn't need to come into the hospital. He knows his body, etc. He left AMA with the antibiotics he came in for and told to return if anything changes. The patient came in the next day. The toe fell off. Patient gets diagnosed with cancer. Doesn't follow up with the surgeon. And many calls were made by the surgeon to get the patient to meet in the office. 6 months passes and the patient shows up in the ED for something unrelated. Ask about the cancer and how treatment is going. The patient says they never followed up because I had a lot to do that weekend. The spouse was right there and didn't appear to know about the diagnosis. Some are funny and some are just heartbreaking and sad. And unfortunately, the patients are not the only ones that make incorrect diagnoses, but occasionally the doctors do too. Until the 4th paragraph I thought they were all the one person. This happened in med school. I was taking the history of a guy in clinic and I asked about his past medical problems, including if he had had any heart attacks. He responded, "Oh yeah, I've had about 20 of those." You've had 20 heart attacks? Yup. Which doctor? Did you see about them? Do you have a cardiologist? Nah, I never went to a doctor. My wife is a massage therapist, and whenever a heart attack hits, she starts to massage some pressure points and it stops. Okay, what does it feel like when you have a heart attack? I don't ever remember them. My wife tells me that I fall onto the floor and my arms and legs start jerking. She says it takes about a minute of her massaging before it stops. I then get really confused and tired afterwards, and I can't remember much of anything that happens to me until I take a nice long nap. The dude was having seizures and thought that they were heart attacks. They normally stop on their own after a few minutes, at the most, and his wife thought that her massages were curing him. This is only tangentially related to the topic at hand but gave me great joy at the time, so I thought I'd share. During my time as an intern, a patient was admitted for anemia, hematocrit of 16, requiring blood transfusions. Turns out that at some point in the past, after she was diagnosed with an inborn error of metabolism, her primary care physician prescribed her vitamin B12 injections. Your body requires B12 to make hemoglobin. Instead of going back for refills after she ran out, however, she headed over to her local pharmacy, bought vitamin B6 tablets, and proceeded to take 2 per day, and went on to explain how, "You know doc, it's the same thing." Yeah, no. Silly woman. Everyone knows 2 B6 pills make BB12, not B12. Someone thought they had a strained muscle in their leg because it locked up and they couldn't bend their knee. Then an abscess formed at the top of their leg right at the pelvic bone, and blood pus started literally pouring out, non-stop, for days. Eventually he came to the doctor's office, then straight to the ER, and had an abscess in his psoas muscle caused by a perforation in his small intestine. Yep, pretty far off on that guess there, but apparently it happened right after some heavy lifting. To be clear for all you gym rats, no, it was not in any way associated with him lifting. It was a result of undiagnosed Crohn's disease destroying his intestines. I had a male PT come into the ED complaining of breast lump. He anxiously stated that the mass was very painful to touch and was convinced that he was going to die of breast cancer. After a battery of questions I asked him to take off his shirt so I can examine and palpate, read, touch, the mass. After a couple of seconds, I turned to him and said, "Sir, that lump is your rib." He called me a dumb kid and asked to see my attending. I was a student at the time. The PT asked the attending why, if it is a rib, that it would hurt so much. The doc replied, "Sir, you've been rubbing and irritating the area for days now. You've been hurting yourself. I've never seen a man leave the hospital that fast. The number of times I've done that is ridiculous. My most embarrassing breast cancer scare, though, is when I went to the doctor because one breast seemed lumpy and way bigger than the other. Turns out my breasts are just lopsided. He wrote it on the chart. It hurt my feelings. While working as a nurse, had a patient who insisted that her abdominal pain was from a surgery she'd had done on her arm. She thought that a staple that had been used to close the wound on her arm had somehow traveled to her abdomen. She thought that a staple that had been used to close the wound on her arm had somehow traveled to her abdomen. What? Had a guy come in for migraines and confidently proclaimed that the severe head trauma he had suffered 1 month prior had nothing to do with it. Patient was dizzy. Patient thought she had a brain tumor. Went to the medical general practitioner. General practitioner thought she had a chronic middle ear infection. Went to the ear, nose and throat physician. End diagnosis: pregnancy. Not a doctor, but a pharmacist, so I hope I'm allowed to play. Patient had a cold, convinced they were severe sinusitis, a bit of a known hypochondriac. Saw doctor, got script for antibiotic, was convinced she was allergic to every antibiotic tried until all that was left was antibiotics which aren't usually used in ERTs at a subtherapeutic dose, because she's very sensitive to medications. The infection wasn't going away, so she took antibiotics for longer and longer. She somehow got her hands on a blood glucose machine and must have had a reading that was slightly low one day, because all of a sudden she started buying bags and bags of jelly beans because the infection is making my blood sugar go dangerously low. Fasting for mol, so normal. So she is taking more and more glucose, moved on to the straight glucose powder now, to control the dumping syndrome. I don't think she even read the wiki on that one, that the infection caused. Symptom of her dumping syndrome: blood glucose dropping rapidly, because she is on a diet consisting of pretty much solely pure glucose, to dangerous levels. 4 mol. She is testing her blood glucose on average 20 times a day and taking about 250 gm of pure glucose at least, from us, plus supplementing with lollies from the supermarket for some variety. We've consulted with the doctor. Nobody can convince her otherwise. We've all tried. She's put on 15 kilograms in the last month or so and will definitely end up with diabetes soon. Doctor made a mistake the other day. In desperation, she said to her, in her 3rd appointment that month, "You should count yourself lucky. There are people far worse than you that can't even get out of bed." Next minute, she now gets deliveries because she is so sick she can't get out of bed. TLDR. Lady had a cold, is now giving herself diabetes by living on pretty much just simple sugars. She needs mental health evaluations. How the heck does someone like that function? Where does she get money to live? So many questions. Had a 19-year-old girl come in asking for antifungal medication because she was convinced she had oral thrush. Her and her boyfriend had googled her symptoms, and at 19 you're never wrong. When I suggested that perhaps we check an EBV antibody to rule out mono, she looked at me like I was actively drooling on myself and refused, because there was no way I can have mono. Eventually I convinced her to have some diagnostic testing done, and sure enough she had mono. I tried to explain that having oral thrush as a 19-year-old could possibly be much more concerning than mononucleosis, but she didn't seem to get it. I had a doctor go too far the other way. At 19, I got thrush partway through a course of Zithromax for a nasty case of bronchitis. Internist flat out refused to give me antifungals, and sent me off to get an HIV test and see a gastro. 2 days of pain and no food later, a gastro saw me and, yup, known side effect, take antifungals. GRRR. Not exactly a misdiagnosis, but my favorite misunderstanding. My dad worked as an doc for 30 years, and started practicing in Alabama way back. He said he had a lot of illiterate and uneducated patients. He was taking one woman's medical history on a visit and she told him she had fireballs of the Eucharist. Translation: fibroids of the uterus. If going to church allowed you to cast fireballs of the Eucharist, I might consider going. Had a friend come to me claiming she was surely dying and had colon cancer. She had dark stool, among some other things, the bloody stool being the smoking gun. I asked her what she had been taking to help with her stomach pains. She said Pepto-Bismol, of course. I told her to stop taking the Pepto-Bismol and told her to go see her primary physician about it. Sure enough, it was just the Pepto-Bismol. It says in the label it can darken stools and your tongue BTW. Happens to me every time I use it. The black tongue is the worst part. As a self-diagnosing patient, one day notice a white, hard, jagged object protruding from my back gum. Can't believe I'm having a tooth come in, especially since I'm 23 and had my wisdom teeth taken out years ago. Go to the dentist to get some x-rays and it turns out to be a piece of a tortilla chip. I'm sorry you have Doritos. It's fatal. Just finished med school, so not too much experience, but had an elderly woman come in here with new onset seizure. The patient's daughter was convinced her mother had a brain tumor. On review of the medications, turns out the patient had been out of her Xanax prescription for 4 days and had a withdrawal seizure. Oh god, withdrawals. If I didn't know what withdrawal was, I probably would have thought I was dying when I went off some of my medication. I also want to add my favorite correct patient diagnosis. A female doc I know at my school likes to tell this story as an example of why one must always ask for patient attribution. That is, what do you think is causing your problem? Really old guy came in complaining of foot pain. He was diabetic. Lady doc already has a diagnosis in mind, but goes through the whole shebang. At the end asks, and what do you think is causing the problem? He goes, I think I have a tack in my shoe. He had a tack in his shoe and couldn't bend over to get it out. She helped him remove it and he went on his way. So I'm a therapist and I work with kids. Worst misdiagnosis was a family with a 2-week-old who was convinced the baby had 1. Anxiety because he cries. 2. Autism, little eye contact. 3. Bipolar disorder because baby would seem content then angry. I spent hours explaining child development, what these diagnoses mean, how they would present in kids. I provided them with books, handouts, etc. They insisted on going to see my co-worker and a psychiatrist as I was surely lying to them. Even after meeting with the other 2 professionals, they still weren't convinced. They requested psych meds from the doc. 2 weeks old. Holy crap. That poor child. The parents are going to fall apart as that baby gets to a month or 6 months. Whoa. Not a doctor but a physio had an elderly female patient ask if she should go and have her prostate checked because her father died of prostate cancer at her age. Bless. I shouldn't laugh at this, but given the fact that the rest of these are pretty harrowing scary stories, this one made me smile. Less self-diagnosing and more self-treatment. My wife is a nurse at an allergy clinic. She had a patient come in saying that she was having issues managing her allergies, even with self-administered injections of liquid Benadryl. Suffice to say, the doctor had to have some very strong words with her. She's actually had a number of unique patients come in, like the lady who worked at a greenhouse and was convinced that she was allergic to the birds that hung out there, and brought in some of their feces for my wife to perform a scratch test with. That did not happen. Man came into the ER in a panic thinking he had incurable skin cancer. Turns out he had a wart on his foot. From all the skin cancer awareness campaigns I've seen, it's hardly a stretch to go from new, rapidly changing wart to skin cancer, especially because foot warts can be really bizarre looking. A lovely healthy 50-something lady patient presented with her best friend because she was unable to walk. It turns out she had been becoming weaker over the past couple of months and now had been bedbound for 2 weeks. As she talked, she waved her hand over her right breast and mentioned something about a problem there. I took a look. She had breast cancer that was so advanced that it was ulcerating through the skin in an area about the size of a small orange. I'll never forget seeing that. It's such a shame because she was such a lovely lady. We talked for about half an hour and during that I found that she had put it down to a lot of stress overwhelming her life lately to do with her son leaving home and a few other things. She seemed like a spiritual lady, and she was so sensitive and overwhelmed at the time that I had to take things very slow with her. During that 30 minutes I really felt that I connected with her and slowly helped her understand what was actually going on and that the next few weeks would be tough with treatments, etc. This was about a month after I had started as a junior doctor. The next day I got a complaint to my supervisor by the head nurse for taking too long with a patient, plus a whole lot of other made up stuff about being unprofessional etc to make her claim sound better. Had to go to meetings with management etc. Anyway, the reason the patient couldn't walk was because of high calcium from metastases all through her bones. I treated that and she was able to walk again a few days later. I looked up her file about 3 months after and she was still alive, on hormone therapy to slow the cancer's progression. You did exactly the right thing. Medical care is patient-centered. If anyone tries to tell you otherwise, you can pull out a few books about proper patient care and tell them to take a hike. Self-diagnosis. I'm an orthopedic surgeon, so patients are really often unable to diagnose themselves because they don't have the power of MRI or scoping. The most incorrect self-diagnosis I've encountered was a patient who believed they broke their hip after a fall when they actually had a 2-inch piece of skateboard lodged into their side they forgot about. Yeah. Forgot about. Hey, that's where I put it. Thanks doc. Veterinary technician here. Twice I have had people worried that their dog's abdomen was covered in ticks. Turns out both times to be the nipples. One of them stated someone told them to try to burn the ticks off. Another one asked why their male dog had nipples and why they had never seen them before. Another one was a guy that brought his 3-year-old beautiful spaniel in because he saw tapeworms all over his rear end. Dog comes in severely lethargic and with a diaper on. Dog also had severe diarrhea. When I pulled back the diaper, maggots everywhere. He said he googled a picture of tapeworms and that's what it looked like. No. Dog apparently had a small wound near his rear that got infested with maggots and by putting the diaper on, it only exacerbated the problem. Dog ended up dying later that evening after spending hours removing the maggots, shaving hair, and administering every medication we could. We told the guy next time to not Google things and bring in his pets immediately if there is ever anything that seems off. I think he learned his lesson. Man, I could have gone my whole life without reading that. My boyfriend was born in a teaching hospital. Because of the size of his head, a bunch of doctors informed his parents that they believed it to be a brain tumor just days after he was born. It ended up being that he just has a huge head. Looks like yeah boy had a case of terminal noggin. He gonna have that melon till he dies. I've had a patient claim that amputations run in his family. He said that was the only reason he needed both legs taken off above the knee. He was adamant that it was not actually due to his uncontrolled diabetes, his enormous and continual sugar intake, his refusal to use insulin, or his refusal of treatment for the giant infected wounds on both feet. I'm not a doctor, but a medical translator. I was translating for a refugee patient who asked me to tell the doctor that every bone in her face and hands was broken. She was very insistent that this was the case. She also asked the doctor for a full body beautification surgery and this was at a free clinic. It was apparent that her face and hands were not broken and when I relayed the information to the doctor he looked very confused. I'm pretty sure the patient was just a bit crazy because they sent her out of there with nothing more than some margarine. Patient is diagnosed with invasive ductal carcinoma of the breast, confirmed with biopsy. Surgery prepped for 2 weeks time. Patient goes to an outside facility and does a mammogram. Radiologist read states it is benign. Patient writes an email to her primary doctor, my attending, prayer works. Please find attached report stating I no longer have breast cancer. Please tell Dr. X, surgeon, that I will be no longer needing surgery. Cue furious emails to surgeon with sense of impending doom. TLDR, mammograms don't pick up everything. TLDR, I think I'm having eye strain induced headaches. In reality, the bone marrow in 1/3 of my skull had turned necrotic. It was the summer of 2008. I was at work with a massive headache. I decided to head home early, thinking my eyes were acting up again. I'd suffered from severe light sensitivity since I was 12. This wasn't entirely uncommon. In the lobby of the building I pass out as I'm nodding to the security guard. I wake up in the hospital. The doctor is talking with a nurse insisting I get another set of x-rays. There's no way this is right. Have a different tech take another set of images. Then he walks out. I'm asking what's up. No one is explaining anything. I have another set of x-rays done. A bunch of other scans of which I still don't understand the differences. And eventually the doctor comes in. Still no one has explained anything to me. No matter how much I ask, wait for the doctor to get back. Finally the doctor comes in and tells me they're going to need to prep me for surgery. I immediately ask about my eyes. He seems confused. Did no one tell you what's going on? Doctor gets all upset. You're missing 1/3 of your skull. Or more appropriately, the bone marrow inside the entire right side of your head is necrotic. It's just sitting there between slivers of bone. When's the last time you've been to the dentist? I don't know. 10-15 years ago. I was planning on going next month now that I finally have insurance for the first time. Well, we're not sure how it is you're alive, but this has been building for at least 10 years. An abscess in your gums has burrowed up into your bone. A week later, after a bunch of specialists are consulted, I had my teeth, gums, soft palate, and entire right side of my skull drained of fluid and removed. I was awake through most of it, and no amount of pain medication was enough to deal through the worst of it. Everything was replaced by mostly a plastic polymer, with some metal studs to snap everything together. And now I'm thinking it's time to visit a dentist again. You've been visited by the good policy grandpa. You will be blessed with good economics and healthcare, but only if you comment sleep well burner. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check out another video, or don't. Either way, have a great day you magnificent people.